Hey y'all, it's Mary Lou with Nursing in Progress. All right, let's go over this fundamentals section 2. I did promise you guys I was going to get it, so I'm getting it. Awesome. So let's go into the sensory receptor. For some reason, this chapter was very, very hard for me. But now that I'm kind of understanding the sensory part of it, I'm actually going to share with you guys a few things that I'm learning so that hopefully, you guys could pass your test and we could all, move on. All right, so it's section 2, sensory and pain. All right, so exam 2 section. The nurse checks a patient's pupil with a pen light. Which receptor is the nurse stimulating? The answer would be photoreceptors. Why? Because they're located in the retina of the eyes. So anytime you see, I'm going to give you guys keywords to look for. Pupils would be the eyes and the pen light. Like she's going to get the pen light and put it on the patient's eyes, pupils. So that's what she's really looking for. She's looking at the photoreceptors. So anytime you do see a question about that in the test, just think of like pupils, pen light. Okay, so she's going to look in there. So what is she really looking at? Photoreceptors. All right, moving on. Sensory chapter. Let's do this. What structure in the brain controls the consciousness and alertness? So that one is reticular activation system. Alrighty, let's keep moving. And remember we talked about nursing diagnosis? Alright, so let's get one in here. Which nursing diagnosis has the highest priority for a patient with impaired tactile perception? So what I want to put in here is, remember tactile means touch. That was something I don't know, I had a little difficulty with that one. I have no idea why, but it kind of makes sense. Like now that I think about it, it's tactile, touch, T. So like when I think of tactile, I know, okay, it's touch because it's tactile. I'm touching something. So the keyword here would be impaired tactile. Impaired means like they're having, they can't have that sense, that sense of touch, right? So let's think about it. We're looking for a nursing diagnosis. We're looking for an impaired tactile, so they can't touch, right? So what's going on? What's going to happen to a patient that can't touch something? Well, let's see. The answer is going to be risk for injury due to the fact that if the patient has like difficulty touching touching stuff, like they're gonna have a injury for a risk for injury. It's like how I always say, like when you have like a Charlie horse and stuff, you can't really, or your leg fell asleep, you can't really feel your leg. And so then when you try to get up, you're like, oh my god, like you're at risk of falling because you have like a Charlie horse or like a leg cramp or something, because you can't really feel it, right? So that's what I think about, like, oh, okay, I have a Charlie horse, or I can't feel my leg, so therefore like I'm at risk of falling. All right, so as I stated on my notes, if patient can't feel anything, then he can't feel heat, cold, or pain. 90% might be on the test. So this is like a must, like that I literally had difficulty with, but this is probably going to be on the test. Okay, so must know. These are a few things to know, like exophthalmos, which is the bulging of the eyes, when their eyes are like bulging and they're like popping out of the eyeball, of the eye. Anyway, anosmia, losing the sense of smell, insomnia, inability to sleep, and an excessive dry mouth. So if you know these words and you're on the test and you're like, oh my god, I don't know what this means, you're probably gonna guess. So like if you already know this prior to going to the exam, you're going to be like, oh, I know what that is. And then, no, it's going to populate in your brain. And then you're going to more likely, you're going to answer the question correct because you know what that means. So it might say something about, oh, patient has insomnia. What, example, nursing diagnosis. So you already know what that means. So you're more likely to put something that has to be related to sleep. I don't know if that makes sense, but that's something that I usually do. I know what the vocabulary is, and then when there's a question in there and I already know what it is, then I'm more likely to get the answer correct due to the fact that I know what that means. I know what keywords to look for, and then that's like a likely possibility of getting a higher score. Okay, so what there's other vocabulary that you must know. Sensory perception, especially since we're going to go into the tests, there might be like a 30% or 40% questions due to regarding to sensory. But if you know what these are, you're more likely to get the answer correct. So like vision, think of like, I'm pretty sure this is pretty easy to remember. You're seeing something, the light rays on the retina. Hearing, sound waves in the ear. Okay, so now Olfaction is cranial nerve 1, and that's smell. You're smelling. So when you there's something in there about olfaction, it's probably talking about smell. Gustation is taste. Gustation, taste, and tactile, as we mentioned prior, is touch. Okay, so no more questions and answer. The nurse is caring for a dementia patient who becomes agitated every evening. Which intervention by the nurse is best for calming the patient? So intervention, remember, we're intervene. That means that we're doing something. We're doing something for that patient to calm down. So the answer would be you're playing soft, calming music during the evening so that they could, calm down. Sometimes when you put music on, it kind of calms you down. Obviously, it's the type of music you put. You're not going to put some hard rock music and like get them agitated, because sometimes that does get them agitated. You're going to put soft, calming music for them so that they could calm down. And then when it's time for them to take a bath, then they're already calm, and you're not suffering as much as like trying to calm them down. All right. So let's move on to more questions. So here's another one. Which instructions should the nurse include when providing discharge teaching for a patient who has visual effect? Keyword to look for is visual. Visual is you're seeing. They can't really see. They're having problems seeing. So remember, visual is see. Just keep saying it so you can remember, because sometimes in the test you might get so nervous. But if you're looking for keywords, you're like, oh, I know what this means. I know what that is, okay? Because sometimes, like, when you're testing and you're so nervous, like I am, simple words like that, you're like, oh my God, how did I get this wrong? But if you're like looking for it already, you go in there, you're looking for it, boom, boom, you're getting those questions correct. All right, so the answer for that specific question would be avoid using throat rugs on the floor due to the fact that they're not really seen. So like the patient's having problems seeing. It's like, I don't know, for people out there who use glasses, like they can't see something, they're at risk of falling, right? So it's like an older patient. You're going to avoid putting rugs there because they're going to fall. All right. So remember, patient can fall and trip, and we don't want that. A nurse, here's another question. A nurse must irrigate the ear of the child. How should the nurse pull the peanut to straighten the child's ear canal? So the answer is going to be down and back. So just a keyword to remember. Remember, for an adult is up and back. For a child is down and back. All right, so let's move on. Chapter 31, let's do this. Older adults, what shall we know? Which assessment finding is considered an age-related change? And the answer is presbycusis, which is a loss of hearing. If you know what presbycusis is, then you know that it's a loss of hearing. And that's why many older adults wear hearing aids. So it's a good thing to know that. Those are one of those things that you must know what that word is, because it's probably going to come up a lot. Alrighty, so when talking about sensory, we need to know this just in case it comes up on the test. And as I stated before, it's probably one of those things that we're going to be talking about a lot. One of those vocabulary that you're like, okay, I need to know what it is because everybody's saying it, but I don't know what it is. Okay, so here's another question. Which intervention is helpful when caring for a patient with impaired vision? As we stated prior, we talked about this. Impaired vision, they're having, issues. They can't really see. So that's the key word you're looking for, impaired vision, having problems seeing. So the answer would be place the patient's eyeglasses within reach. It would kind of make sense. Like, just think about it. People that wear glasses, they have their glasses right next to them so that when they wake up, they could see. So that's something to keep in mind, and it will definitely help us out. All right, let's get going with more questions, guys. A nurse suspects that a client is experiencing sensory deprivation. Which nursing diagnosis should the nurse select to plan the client's care? And the answer would be decreased diversional activity. This means that the client has multiple sensory issues and the diagnosis is mostly appropriate. Diversional would be like a decrease in stimulation, and because of the internal or external factors that the patient may be having. All right, moving on. The client has a hearing impairment and comes to the clinic for treatment. What action should the nurse take to enhance communication with the client? The answer is use touch to get the client's attention. Hearing impairment. So the patient's having difficulty hearing. And, sometimes us as humans, somebody can't hear us. What do? We yell. We're like, can you hear? Like we're trying to talk to them, like trying to scream at them. But in this case, like, this is an older adult. We're not going to want to yell at them because they can't really hear us. So what we would do is we would use touch to get their attention. We touch them lightly and just tell them, hey, can you, and whatever you're going to ask them, but not yell, which is something that sometimes everybody just, they just tend to like yell and whatnot. All right, so that was actually the end of this chapter, and I hope you guys enjoyed it. Thank you so much. You guys have a good one. Bye.